Today we're going to be talking about the 5 products that you can use at home in between dental appointments to enhance your dental health care.
Down in Brookhaven, with a smile shining bright, Dr. Langston's working late into the night. With hands steady and a gaze so keen, he's the best on prosthodontist you've ever seen.
Hi, I'm Dr. Brett Langston. I'm a prosthodontist. I'm the owner here at Dental Implant and Aesthetic Specialist in Brookhaven, Georgia. I would like to clarify, for legal purposes, I'm not sponsored by any company. This is all just advice from me to you. Whatever brand you want to use, as long as it falls within these kind of guidelines, is totally fine with me. I don't receive any payment or compensation for any of the products listed. The number one most important thing is an electric toothbrush. What I like to tell my patients is we don't use horse and buggy to travel across the country anymore, so why would you use a manual toothbrush? The leaps and bounds in technology of the sonic vibrations, the oscillations per minute, the vibrations that it makes can reach deep into the pockets, and it's night and day. An electric toothbrush, and like I said, the brand Oral-B, Sonicare, they're all great. They all have pros and cons. There's lots of other companies out there that make great electric toothbrushes, but the point is the amount of stimulation of the gum tissue, the depth that they reach into the sulcus, the cleaning, the removal of debris, it really is, that's the number one recommendation I can give patients, is to use an electric toothbrush. The number 2 item is an interproximal rinsing device, which is a long fancy word for something like a water pick. Basically what that means, it's an instrument that applies a heavy pressured water spray in between the teeth and around the gums and the gum tissue to really flush out debris in areas that you can't quite get to with your toothbrush, or that flossing doesn't allow you to manually reach. The one caveat I would have is that water picks create a lot of water and a lot of spray, so you have to use them over the sink, but they do a really good job of supplementing the electric toothbrush and making sure you remove any debris and bacteria to get that mouth nice and healthy. So the third factor is a mouth rinse. Now I know this is kind of a hot topic as to whether you should have one with alcohol, one with fluoride, one with different materials, and every company has their brand new latest greatest. But for me, the most important thing is something that you will use on a regular basis. So whether that's the alcohol free or whether it has some alcohol in it, the nice thing is if you go down the supermarket aisle, you will see a wide variety of options, whether it's fresh mint, orange, water. I mean, there's so many flavors and styles and components to different brands. You can always find one that fits your personal preference. So I highly recommend that. And the big advantage of that is the mechanical swishing of the mouth rinse not only removes debris, but also if the mouth rinse has components of fluoride or other particles that are good for the teeth, it'll help kind of bathe the teeth in those solutions. The number 4 that I would recommend is some kind of interproximal manual appliance, whether that's a floss or a soft pick. So floss is great when you've got good solid contacts because it can go down between those teeth and really clean out the debris in areas that the toothbrush doesn't quite get to. But sometimes we have patients that have teeth that don't have nice contacts, whether they're crossed over or bigger gaps, or if you have a bridge that's got a lot of space under there, or a hybrid or some kind of other appliance that's hard to clean, or if you don't have the manual dexterity to take floss and get to those areas, something like a soft pick or a go-between is a really valuable instrument in removing debris, because the number one cause of decay and cavities is when you leave bacteria and food pushed up against the tooth structure. So for those hard to reach places, those little nooks and crannies that you can't quite get to, something like floss or a soft pick or a go-between is ideal. The number 5 item is toothpaste. With toothpaste, there are so many different options, so many different flavors and styles to choose from. Really pick one that you're going to use, but I do have a couple warnings. Number 1 is you want to make sure it has fluoride in it. And again, I know that's kind of a hot topic, but fluoride is absolutely crucial for your tooth to protect itself and protect that outer enamel layer from the damage and wear and tear on a daily basis. You want to avoid anything that's labeled as super bleaching or as very abrasive. Unfortunately, some of these companies that come out with these toothpaste that are advertised as mega bleaching or make your teeth 50 shades whiter. The way that they do that is they have really large particles, and those particles will abrade that enamel structure, which short term is fine because they actually do remove some of that stain and some of that wear and tear. But the problem is they leave scratches and indentions on that enamel surface, and then those scratches are just going to pick up more stain and make the problem even worse. So you may have a short-term gain with those kind of toothpaste, but in the long term, you're really damaging your teeth and setting yourself up for future dental needs. For an added bonus, I would add in a tongue scraper. Now, while it's not absolutely necessary for your tooth health, a lot of bacteria and a lot of the bad taste and smell that you get in your mouth is harbored in the deep grooves on the back of your tongue. So a tongue scraper is going to do a really good job of freshening your breath, removing a lot of that bacteria that might not have gotten taken care of with some of the other appliances that you use. So to summarize, when you go down that drugstore aisle and there's so many options, so many different things, it can be very overwhelming. But what I want you to remember is electric toothbrush, a water pick or some kind of water pressurized system to go between the teeth. Floss, or something to manually stimulate the gum tissue and go between the teeth and clean. Toothpaste, something with fluoride in it, something that's not super abrasive and is going to really rub the particles wrong. And mouth rinse, something that you use that is FDA approved and you can flush out the particles and give yourself fresh breath. By sticking to these 5 dental tools between dental visits, you can reduce and eliminate a lot of dental problems that will come up later. So if you've got a question about any of those, leave a comment below, reach out to us. I would love to talk to you about it. I'm Dr. Brett Langston. I'm here to help you watch your mouth.
Down in Brookhaven, with a smile shine bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on prosthodontist you've ever seen.